Hey guys, today we are going to discuss regarding chronic bronchitis, a kind of a COPD that is characterized by sputum production for more than 3 months for 2 consecutive years. That is a very important fact. Commonly it happens due to uh, airway exposure to various cigarettes smoke, as well as there is outdoor pollutants. These are the important causes of chronic bronchitis, and the patients are generally obese, and often there is a cyanosis, bluishness of the mucosa is being seen because the deoxygenation is not compensated, so they are known as blue bloaters. And also, along with that, because of that hypoxia, there is a secondary polycythemia, and digital clubbing also may be developing, and also patients are prone for various infections. And here what are the key facts? The pathogenic events that characterize chronic bronchitis include because of the exposure to the noxious stimuli. Here you will see a smooth muscle hyperplasia. There is a mucus abnormality, mucus hypersecretion, goblet cell hyperstimulation is seen. That so mucus gets accumulated, and there is a hypoxia that leads to vasoconstriction. There is a smooth muscle hyperplasia, both the airways and the pulmonary vasculature, that leads to further narrowing, and the mucus accumulation can be further confirmed by the RID index. The RID index, here it is more than 0.5, that is the ratio between the submucosal gland thickness to that of the distance between the epithelium and the cartilage plate. So that this ratio is known as RID index, which is more than 0.5. That is the characteristic feature over here in chronic bronchitis. Patients, as I told, they are blue bloaters compared to that of pink puffers in the emphysema. There is a hyperresonant chest, and the chest X-ray may show more of lucency. Radiolucency may increase with decreased lung markings may be noted. So these are the key facts of chronic bronchitis. And apart from that, the pathogenic events that are characteristically seen in the biopsy are: there is a smooth muscle hyperplasia, gob and mucus accumulation that we discussed. And one of the important component that can also happen, one of the important feature could be squamous metaplasia and dysplasia of the larger airways because of the persistent inflammation. Inflammation is by neutrophils and chronic inflammatory infiltrates like CD8 T lymphocyte. These are the predominant ones, and they release lots of reactive oxygen species that lead to further damage of the airways. So these are the key facts of chronic bronchitis. How to manage these patients? So best strategy is avoidance of cigarette smoke, and also avoidance from the pollutant exposure. And apart from that, if patient may be given inhaled corticosteroid, and a long-acting beta-2 agonist may also be given in these patients for dilatation of the airways. So now let's have a very quick review of what we learned today in chronic bronchitis. So please make sure to jot down the important points. So chronic bronchitis is characterized by more sputum production of more than 3 months for 2 consecutive years. Patients are obese, blue bloaters, they are with frequent episodes of cyanosis, and the patient will also develop polycythemia and digital clubbing due to hypoxia, and also may prone for infections. RID index, which we discussed, is more than 0.5. That is the characteristic feature. And apart from that, there will be pulmonary vasoconstriction, pulmonary hypertension that may eventually lead to cor pulmonale or right heart failure. And we discussed that here there will be the patient has to be managed by inhaled steroids and long-acting beta-2 agonist, and along with that, avoidance of the cigarette smoking and the pollutants is also the best strategy. So hope you like the video. Please share, like, and subscribe the video, and also let us know what kind of videos you would like to see next in our channel. And also please connect us for regular pathology teaching, as well as any kind of a crash course. We have recently launched 10 days crash course for pathology teaching, so you are welcome to contact us for any individualized one-on-one sessions. Thank you and happy learning.